Hi everyone, my name is Dr. Z. I am a clinical psychologist specializing in transgender care. Welcome to my channel. If you are new or a regular viewer and you have not yet subscribed to this channel, please do make sure to subscribe. This way, you're not only helping support me, but you're helping so many other people find this free and, in my opinion, very valuable content. If you don't yet follow me on Instagram, link is below. Make sure you also stop by Instagram, say hi, connect with me. I'm there daily giving you additional tips, guidance, as well as I do Q&As on Instagram. So please go ahead and connect with me on Instagram as well. Having said that, I hope all of you have a fantastic October. I'm recording this in October. I love October. It's my favorite month. It's also the month where I happen to have my birthday. So it's also, in addition to that, my favorite month. So hopefully all of you having a great October month. I know it's very stressful for a lot of you because we're on the brink of election in the United States. And I know for a lot of you, it is a very stressful time period. For today's topic, we are going to be discussing how feminizing hormones specifically affect sexual drive. This is a question that creeps up now and again for a lot of individuals. I had a lot of individuals who are either in a relationship and as a result don't want to go on feminizing hormones, even though they do struggle with dysphoria and feel that feminizing hormones will help them in the long run. They don't want to go on feminizing hormones because they have concern that it will affect their sexual drive, and as a result, they won't be intimate in their relationship. There are a lot of people who are not in a relationship but are sexually active, which is very important. Sexuality is a very important part of human development, very important part of healthy lifestyle. So there's a lot of people who are not in a relationship, but also sexually active and also concerned about that as well. I know that there's a lot of individuals who identify as trans feminine who have no interest of getting bottom surgery and therefore still want to be able to have their genitals to be sexually functional for sexual purposes. So this video for anybody and everybody who is concerned about sexual drive, your sexual libido, if you will, is it declining or going away on feminizing hormones? And when people talk about sexual drive declining, I would say we're really looking at two things happening here. One thing is sexual desire, sexual drive declining, and another one is actually certain components of functionality decreasing. For example, being able to maintain and sustain erection during sexual intercourse. So we're looking at two primary things. And over a long time working in transgender field, I find that there is an overarching, a generalized myth in regards to feminizing hormones that sounds along the lines of, if you do go on feminizing hormones, you are definitely going to have decrease in sexual drive, and you're definitely going to have decrease in sexual function, where you're not going to be able to have any penetrative intercourse. You're not going to be able to enjoy sexual lifestyle. And one of the things I learned working with so many clients, keep in mind that my private practice with individuals that I work one-on-one, I would say probably 85% of my personal clientele are actual trans feminine identified. I think there's a lot of reasons why I think that is, but I think perhaps also part of it is that because I'm a woman myself, and so there's that comfort level there. But because I work with so many individuals who primarily trans feminine identified, you can only imagine that I had a chance to witness a very large pool of individuals go on feminizing hormones, and I was a part of being able to ask them and follow up whether their sexual drive was affected. So having been exposed to so many individuals and what happened when they went on feminizing hormones, I'm here to tell you that this overarching myth that your sexual drive and your sexual function will definitely decline is not true. It is not correct. The key here is individuality. And what I learned over the course of my career is that everybody is so drastically different, and everybody's sexual function is different. The thing behind our sexuality is that even if hormones are affecting your sexual function, being able to get an erection, if you still have a very robust sexual drive and desire, that's also going to play a role in influencing that in a sense of being able to help you achieve erection. It takes a few things to work together in order to produce particular results, right? It's not just all about being able to maintain and sustain erection. This is why erectile medications such as Viagra, for example, it's there to be able to give that sexual function, to give that erection, but it's not going to give you sexual desire. So if you have no desire at all to have sex, but you took Viagra, well, you can only imagine what's going to happen. So I just want to break it down to those components because a lot of times we disregard one or another, and two of them are play also a significant role. Having said that, one of the things that I want to point out is not only in the realm of individuality, in a sense, how it affects everybody differently, but again, it's also going to affect everybody differently based already on their natural predisposition toward their sexual drives, their sexual libido. Sexual drive essentially is how would you describe your needs, your sexual desires? Some people have a high sexual drive, which means they would like and have a need or have a desire, have a want. And I want to be careful here to be clear that having high sexual drive is natural, it's normal. Where these individuals want to have sex maybe several times a day, several times a week. Then some people have moderate sexual drives. They always, all their life, had moderate sexual life, where they've been wanting to have sex maybe for several times a week. Then some people have a lesser of a sexual need and desire, where their sexual drive is once or twice a month. All of this is normal. It's almost like having an appetite for sex, right? Everybody's going to fall into different category for their appetite for sex. And depending what your appetite is, when you're studying feminizing hormones, it's also going to play a role in how it's going to affect you. Before I tell you what my observation has been, let me tell you this. One of the big misconceptions why people just automatically assume that sexual drive and sexual function are going to decline on feminizing hormones is because, one, they assume that everybody who's on feminizing hormones is also taking some form of testosterone blocker. So we're talking about, for example, even though some of them are not specifically blockers, they fall in the category of lowering or siphoning testosterone production, right? So we're talking about spironolactone, short for Spiro, Lupron, biclutamine. There's another one in Europe, starts with O, I forget the name of it. Finasteride, for example, even though a lot of people take it to prevent hair loss, it also affects testosterone. So people just assume that you're probably on one of these medications, and as a result, because your testosterone levels are going to be tripling down, well, that's why your sex drive is going to completely disappear. We have to be careful here not to associate sex drive immediately with necessarily a masculine-driven hormone, right? Let's not forget women who are on estrogen. Let's not forget women who have their natal hormone is estrogen, and they have a robust sexual drive without the high production of testosterone. So that's one of the fallacies. But overreaching fallacies that it's going to lower testosterone to the point where sex drive is going to disappear, and hence your sexual function is going to disappear. There's also a misconception that if you're not on any of the testosterone blocking medication in combination with feminizing hormone therapy, that also feminizing hormone therapy in of itself is going to lower your testosterone levels, which is true to an extent, in a sense of, one, it depends how your body going to metabolize estrogen, and two, it takes a while, and it's usually a particular route of administration too that in of itself can stifle testosterone levels. It also depends what kind of levels are you starting off with. Some people starting with already having natally very high levels of T. Some people have moderate, or they're kind of what considered to be a general population for their age group. Some people are on the lower end. All of these things are just that misconception. And the reality is that you won't know how exactly feminizing hormone therapy is going to affect your sex drive and your sexual function until you actually go on it. What I can tell you from my experience is this. I have seen a lot of trans women, a ton, who have went on both testosterone blocker and both on feminizing hormones, where their testosterone has almost dropped to a very low range, and yet they still were able to have the same level of sexual desire, sexual libido, and they were able to maintain their sexual function. It did not affect it one bit. This can be very frustrating for those of you watching who actually do desire a lowering of sex drive. You actually do desire lowering of sexual functioning. Because for you, that sexual libido, that especially the function associated with it, the erection, all of it might be a reminder of a gender you don't feel connected to and may trigger, in fact, does trigger tremendous amount of dysphoria, not to mention gentle dysphoria. So I know that a lot of people actually do desire the opposite effects, but this video we're talking about those of you who actually want to maintain sexual function, right? So I have seen where it doesn't matter. I've seen people get orchiectomy and still have sexual desire be intact and still being able to have their sexual function intact. I have seen people who have taken a very low microdosing dose of estrogen alone without testosterone blockers and have their sexual drive decline and also have their function decline, where they had really hard time being able to get erection and maintain it. Two very opposite ends of spectrum. And then I have seen everything and anything in between. So it really, really depends. It really depends on you. Again, how your body metabolizes hormones. What are your initial testosterone levels? What is your initial sexual drive is? All of those things are going to play a role. To say that the sexual function completely declines is deeply inaccurate and it's just not true. Some of you watching this may already nodding your head knowing that is that not true. Now, for all of you who are watching this, who want to have your sexual function, want to also have sexual desire, and are struggling with this because you either afraid to go on feminizing hormone therapy even though you want to, or you are on feminizing hormone therapy and it's interfering with your sexual intimacy, your sexual life, there are options for you out there. The most common option that majority of my clients engage with is topical testosterone cream that they get prescribed for their endocrinologist that helps with sexual function. Again, it may not help you with sexual desire because remember, desire is psychological, right? It's a psychological need for intimacy, connection. There's certain things that arouse sexual desire in us. There both can be visuals, they could be something that is related to sense of smell or memory or to a particular texture feel. That's sexual desire. And then there's also sexual function. So topical testosterone cream is by far the most common one. I had a lot of clients use it. They said that it really works wonders for them. And then I had a lot of people who used it and said it doesn't really change much. Just goes to show you that you don't know until you try. Everybody's so diverse. And for individuals who do want to maintain sexual function or who also feel comfortable with their genitalia, using topical testosterone cream feels pretty comforting. It doesn't feel very triggering, and it's not enough to trigger your testosterone production. So something to keep in mind. There are definitely other options that you can discuss with your endocrinologist, but I want you to know that the options are there. Another thing that I want you to keep in mind is that a lot of times in gender transition, you come to an impasse, you come to crossroads, if you will, where something has got to give. And that's just the reality of transition. Transition doesn't solve everything. And at the same time, while it solves one thing, it takes away another thing, right? And that's one of the things to keep in mind too. In this case, if you are struggling with gender dysphoria and want to go through gender transition and want to go on feminizing hormones, but afraid of your sexual functioning and desire decline, you have to kind of outweigh what's more important to you, and what is severity and the degree of distress dysphoria is giving you. But something is going to give. Unfortunately, sometimes it's not going to be a case where you can have it all, because that's just how things work. Something is going to have to shift. And especially non-binary folks know this very, very well, because with medical intervention, when it comes to non-binary individuals, there's always a trade-off, if you will. And a lot of times one has to make the decision what the trade-off is going to be for them. But for all of you, I just want to keep you in mind that it doesn't automatically decline your sexual desire nor your sexual function. In fact, what I noticed for some individuals, their sexual drive might actually go really high up because now they're more in touch and connected to their authentic gender. That's another thing. Your sexuality might actually reawaken and wake up as a byproduct of going through gender transition. Final point I'm going to wrap around to and make is that let's not forget that as your relationship to your body changes, your relationship to sexuality is bound to change. The way you were relating to yourself sexually as a sexual human being on testosterone raging through your body is going to be different. The way you're going to respond to yourself as a sexual person with estrogen in your body. And it's not good or bad, it's just different. And I think it's important for you to know that, to accept it, and to also relearn, rediscover your sexuality and your sexual relationship to yourself and your sexual relationship to another person when you are on a feminizing hormone. So I want to leave you all with that. Comment below, let me know where you stand, whether, the fear of not having sexual function and your sexual desire declining is stopping you from going on feminizing hormones, or if you have gone on feminizing hormones and actually nothing has changed for you. Comment below, let me know, and I will see you all next time. Goodbye.